Hello, I'm student SPT1, Jordy Perry.
I'm SPT Kate, and this is our patient, Jean Gray. She is a 39-year-old competitive runner.
She is struggling running more than 3 miles due to Achilles pain and posterior medial ankle pain, right?
Mm-hmm.
Yeah.
We have noticed that she has some flat feet and likes to pronate her feet. During running and gait, she does not have enough supination going on. She has good knee and ankle strength, a little bit of weak hip abductor and external rotator strength, and she has pain when she performs calf raises.
Yeah. So for our next few exercises, we're just going to be working on ankle stability. We're going to be working on supination, dorsiflexion strength, a little bit of stretching out the calves, just kind of targeting all of those areas that she's struggling with to get her back to running and to running more than 3 miles without pain.
Yep, we're getting her ready for another ultra marathon. Okay, Jean, so you are new to our clinic here. So to start off, we're going to start with some pretty simple exercises. So I've got your foot on a tilt board here, and what I want you to do for this exercise is keep your feet completely flat on the tilt board. And now I'm going to put this resistance band around your ankle, and then what I want you to do is I want you to use the muscles on the outside of your foot and ankle to pull without taking your foot off of the board, to pull until the side of the tilt board hits the outside on the ground. Does that make sense? Okay. All right, so go ahead and just pull until the board hits the ground on that side. And then, yeah, nice and slowly bring it out and bring it back in. Really feel the muscles that are working. This is gonna work on her supination muscles, just so she can start to feel what muscles should be contracting and maybe start to take a little bit of those pronator muscles out. So this is a good beginner exercise. I'm gonna go ahead and have you do this 12 times, and we're gonna go through 3 sets of it. For this exercise, we're going to do a little bit of self-mobilization. So I have Sierra kneeling here on a foam pad so that it's not too uncomfortable on her knee, and we have her foot on a little bit of an inclined board. Your name's not Sierra. What's your name? Jean. Jean. We have Jean on an inclined board here. And now, Jean, what I'm going to have you do is go ahead and grab a hold of your ankle. And what I want you to do is I'm going to have you lean forward onto your foot. So we're getting some dorsiflexion in here. With your hands, I want you to be pushing yourself outwards. So you're putting more pressure and weight on the outside of your foot. So what this is gonna do is this is gonna help push her into some dorsiflexion and also some supination. So we'll start to get some of that range of motion back in for her. And so what I would have her do is I would go ahead and have her oscillate back and forth, holding for about 3 seconds and then coming off. And do an oscillation of about a minute, and then I would have her do this 2 times a day.
Another exercise that we have for Jean is we're going to put her on an incline for some calf raises. So she is struggling with getting more than 10 single leg calf raises. So we're going to use both legs, and we're going to do a little bit higher reps. We're going to do 15 reps here, 15 to 20. So I'm going to have her put her toes on this incline. So she's also going passively into some dorsiflexion, so that's also going to be kind of passively strengthening those anterior tibialis muscles. So I'm going to have her do 15 calf raises. If she needed to, I could have her hold on to something next to her, but we're trying to get her to go up into as much plantar flexion as you can, and then down at the bottom, hold that for a second. 15 to 20 reps, we're going to do 3 sets. Okay, so Jean is also having some ankle instability, so we are targeting that a little bit here too by having her heels off of the edge. This exercise here, this is our second stage, one of our second stage exercises. So we're challenging her ankle stability on this leg, so she's going to go into a little squat on the foam pad. So that's also going to be challenging her abductor strength too on this leg, but we're really targeting the abductors on this resistance band leg. So I have her in a little bit of internal rotation on that right leg. She's going to abduct her leg out and back. Sorry, giving more resistance there. And I'm going to have her do 12 reps, nice and controlled, holding that squeeze at the top for a second, and back down. So we would do 10 to 12 reps here, 3 sets, and have her perform this bilaterally.
All right, so this is an end range exercise we're gonna do, Jean. This is going to stretch out her Achilles, maybe help with some of that pain. This is good for ankle stability. It's good for hip abduction. It's good for proprioception. So this move is really gonna get a lot of good things going for you. So I had her take her shoe off, and what I'm gonna have her do is go ahead and put the ball of your foot in the middle of the Bosu ball and stand with one foot. This is automatically going to put her into a little bit of dorsiflexion, which is gonna help that range a little bit. Now what I'm gonna have you do is try to stand on there with one foot. We're gonna try to do this for 30 seconds at a time, okay? So this is gonna help with a little endurance too, and we're just gonna toss the ball back and forth, okay? So this is good for a whole bunch of things. So we would go ahead and do 30 seconds, and honestly this is a really good exercise, so I'm gonna go ahead and do it with both feet, and we'll go ahead and do this 4 times on each foot.
A level 3 exercise for Jean. We're going to start throwing in some dynamic ankle control, also throwing in a frontal plane movement because running's a lot of sagittal, so it is still important to work on some frontal plane exercises here. So what I'm going to have her do is we're doing a skater exercise onto the foam pad to work the ankle stability, and hip abduction will also be challenged in this exercise. So what Sierra's going to do is she's going to jump onto that foam pad, land in some controlled knee flexion, try to keep the other foot off of the ground, and I'm going to have her do 12 reps on each side, 3 sets.